Hello, I'm Professor Dame Sally Davies. I'm the UK's Special Envoy for Antimicrobial Resistance, AMR. And I'm delighted to be speaking to you today, and I want to pass my sincere thanks to the UKRI Medical Research Council and the University of Exeter for hosting today's event on antifungal resistance, which matters to us all, and our future generations absolutely depend on us making the differences now that are needed. We've got to act if we're going to prevent AMR from being even more catastrophic and having greater impacts than COVID-19 is having. I like to compare COVID-19 to a lobster that's dropped into boiling water because the pain and suffering's immediate and loud. But AMR is like the lobster put into cold water, slowly bringing it up to simmer over time. The result's equally tragic, but silent, and it could be even worse. But your commitments, professionally and personally, can rescue that lobster, and therefore our children and grandchildren. In the UK, our 5-year National Action Plan sets out how we can reduce the need for and intentional exposure to antimicrobials, optimising the use of antimicrobials and investing in supply, innovation and access to tackle AMR. Thanks to our previous National Action Plan, we reduced the UK's usage of antimicrobials in humans by 7.3% between 2014 and 17. We're monitoring progress all the time now. In GP settings, the number of prescriptions dispensed decreased by a great 13% between 2012 and 2016. We've got further to go, but great start. We've also been working hard to build a comprehensive picture of global antimicrobial consumption. A world-first study, for instance, funded by the UK government, the Wellcome Trust, Bill and Melinda Gates Foundation, has just used geospatial modelling using household surveys to estimate that global antibiotic consumption increased by 46% between 2000 and 2018. This demonstrated the global imbalance between lack of access to treatments and excessive consumption of them. For example, the Philippines consumed 9.18 times fewer antibiotics than Greece in 2018. The full impacts of COVID-19 on prescribing, as well as on AMR research and policy making, is yet to be seen. We've seen the increasing pressure that healthcare workers have been under, especially on COVID-19 wards. We've seen that about 75% of COVID-19 patients receive antibiotics, despite only 3.5% of patients being hospitalised for bacterial co-infection. The UK's National Clinical Trial for COVID-19 treatments recently found that azithromycin had no clinical benefit for patients hospitalised with COVID-19, resulting in recommendations to hospitals and GPs not to use this antibiotic to manage COVID-19. Stewardship, though, is easier said than done, but I hope that exciting new innovations, including apps from the WHO to guide prescribing in the community and hospital settings, will help. The UK pioneered the Keeping Antibiotics Working campaign, using media to target both patients and prescribers to ensure that antibiotics are only used and given out when absolutely necessary. Moreover, our PHE developed eBug campaign, which is in 24 languages now, includes resources and activities for schools, including games, and even encourages classmates to work together to investigate the cause of an outbreak of foodborne illness at a dinner party. This knowledge will lead to awareness, which will hopefully lead to more action from people of all ages and levels of society. We all know that there is not a sustainable pipeline of new antibiotics. Sadly, even worse, I believe, for antifungals, even though they all have value to society as critical infrastructure. Last summer, the UK became the first country in the world to launch a new system that will pay companies for antimicrobials based on a health technology assessment of their value to the NHS, not on the volumes they're used in. This is a world-first experiment to pay for antibiotics by subscription rather than per pill. We call it the Netflix model, and I hope it's going to bring 2 new antibiotics to the NHS by 2022. And it also empowers those in the NHS to follow appropriate stewardship of new antimicrobials, whilst providing a return on investment for the company and effective incentives for global investment to develop much-needed new antimicrobials. The selection process for this pilot was designed to favour products that address an infection area of key importance both nationally and internationally, and specifically at this time addressing a key unmet need in the UK, that is effective against resistant gram-negative pathogens in high-risk settings. But points were also awarded in the procurement for activity against the WHO priority pathogen list, as well as for the supplier's demonstrated commitment to antimicrobial and environmental stewardship, with robust plans for surveillance. We went through a rigorous process with expert clinical input and 2 therapies, Cafidorol, manufactured by Shionogi, and Ceftazidime with avibactam, manufactured by Pfizer, are now moving through this innovative health technology evaluation process. And the output of these evaluations will inform the subscription payment price each company will receive for the product. Our model also complements the new exciting AMR Action Fund, a coalition of 20 leading pharma companies, the International Federation of Pharmaceutical Manufacturers and Associations, the Wellcome Trust, and the European Investment Bank, to fund up to 4 new antibiotics with £1 billion investment. It's been pitched as a game changer, and I truly think this will make governments sit up around the world and pay attention, and if it doesn't, it really needs to. The UK supports the Access to Medicines Foundation's benchmark that evaluates how companies are responding to AMR in the areas where they can make the biggest impacts. In 2020, they found 13 companies run or support AMR surveillance programs, compared with only 9 in 2018. I'm so pleased to hear that Pfizer is the first company that shares raw data. Now we need the others to follow. We all know AMR is a One Health challenge, and it therefore needs a One Health solution in collaboration across public and private sectors. At the Department of Health, we're working with new stakeholders to protect our shared environment through addressing AMR. Earlier this year, the UK government, in collaboration with FARE, the UN Principles for Responsible Investment and Access to Medicines Foundation, launched the Investor Action on AMR initiative during the World Economic Forum of Davos. We're calling on investors to commit to making sustainable investments, to make this part of their ESG. We're asking investors to use their influence and align with global best practice on AMR, particularly important in the food chain. We're already seeing a positive response from investors collectively, worth over £7 trillion of investment, and we hope to continue building on this throughout the year and next. I'm really pleased about the leadership that we from the UK have had and will continue to demonstrate on AMR, from our academic institutions to the NHS, hospitals and laboratories, research centres and in the community. People up and down the country are working tirelessly to address this threat of AMR. We've shown we take AMR seriously, and we're willing to experiment with procurement models to do things differently. Later this year, the UK hosts the G7 presidency, an opportunity to work with international partners to build back better from COVID-19. And AMR is a shared priority for these governments to strengthen global health security and prevent future crises. We're pushing for better stewardship of existing antibiotics and reinvigorating the development of new ones too, while making sure our antibiotic supply chain is safe, secure and transparent. And we want to share standards we can all rely on. Under the UK's leadership, the G7 will strengthen R&D innovation and patient access for the whole world. And if we can get it right for antibiotics, then we can follow through with antifungals. AMR is, we know, a global challenge. So hearing of the great progress from across the world gives me confidence that we can rescue this lobster before it's too late. Some of the progress driven by our own Fleming Fund, a £260 million UK aid programme that supports 24 countries in Africa and Asia to collect and use AMR data effectively and sustainably, is helping. Our investments in lab capacity and diagnostic capacity and capability have helped countries respond effectively to COVID-19 through biosafety cabinets, PPE, deep freezers, even microbiologists. Investments on genome sequencing capacity in South Africa for AMR has contributed to the identification of their new COVID variant. Through partnerships between UK NHS trusts and hospitals in Zambia, Uganda, Ghana and Tanzania, we've launched an app to support pharmacists in prescribing with evidence and national guidelines at the core. You know, such data-driven prescribing practices can really ensure antimicrobials, particularly those ones that are last resort drugs, are reserved for patients who really absolutely depend on them, and then make use of the limited supplies and they'll reach more people. As we seek to contain AMR against the backdrop of COVID-19, taking systematic approaches like this are going to be vital. On the global multilateral stage, we now have the new UN Global Leaders Group on AMR. The members, including heads of state, ministers, private sector, and civil society representatives, are bringing their experience and influence to catalyse global attention and action to fight AMR. We hope to use our collective influence and political capital to bring other stakeholders, the public and private, on board. We're working with the UN community, with the WHO, Food and Agriculture Organization, Organization for Animal Health, and the UN Environment Programme to bring our ideas together, bring them to life, and make a difference. I'm honoured to be part of this group. So, by collaborating across sectors and countries, we can innovate to secure the future of modern medicine. I hope your discussions today can continue to change the tide and rescue that lobster for all antimicrobials, antibiotics, and fungi. Thank you. Thank you. Good.